there's a lot of stigma towards people using medications to help themselves emotionally. But yet there's not stigma for people, taking medications for diabetes. It's I don't know.
That's a fascinating thing that you just said, actually. And that's a conversation I have with a lot of our opioid addiction patients. And I actually have on our website, lifesworkclinic.com, there's a blog, and one of my papers that I wrote on there was, questions and answers on buprenorphine therapy. And one of the first questions is, well, aren't you just, substituting one drug for another? That's like a common thing. We actually hear it a lot from family members of people who come to see us. And the answer to that question is pretty simple. Well, yeah, we are. Okay. One has the potential for abuse. One does not have the potential for abuse. One destroys a person's life, potentially. Another saves a person's life, potentially. So, and the conversation I have with my patients so that they understand this is when they get on this drug, it's a lot like someone managing their type 2 diabetes. If somebody, and this is my example, if somebody eats McDonald's every day for 20 years, right? Sometimes twice, okay? And they go to they're 100 pounds overweight. They go to their doctor and they're like, man, I just don't feel right. My mood is terrible. I just feel exhausted all the time. And so the doctor runs some tests, and it turns out that the person's blood sugar is 400. Doctor says, look, bottom line, you've developed type 2 diabetes. You broke your pancreas. Okay. So the doctor says, this is what we're going to do. We're going to get you on metformin. We're going to get you on insulin. I want you to stop eating McDonald's, and I want you to do a little bit of exercise. We'll start walking around the block a few times. Then we'll, up the exercise, etc. We can take care of this. Okay. So the patient comes back in a couple of months later for a follow-up. Blood sugar is down to 200. They lost like 10 pounds. They're doing great. Doctor's like, fantastic. We'll continue the metformin and the insulin, continue to, avoid McDonald's and increase your exercise. Okay, fantastic. Two months later, they come in, blood sugar is 350 again. They smell like the McDonald's they had on the way there. Clearly what they've done is relapsed, right? And the doctor says, okay, so this is what we're going to do. We're just going to start back at the basics here. We're going to keep you on the metformin. We're going to keep you on the insulin. You're going to stop eating McDonald's, and you're going to start exercising again. What happened with the person with type 2 diabetes is they literally, through a series of long-term lifestyle choices, basically broke their pancreas. Okay. Their pancreas cannot no longer keep up with the blood sugar. There's fat in the blood, and they just can't, the pancreas is just broken. So you need the metformin, you need the insulin, right? You can manage it, you can get that down to 200, right? But you're still, you stop eating McDonald's, you start exercising, that's fantastic. But the bottom line is actually damage a part of your body. So it's going to take some medication to treat that. For some reason, and I don't advocate for stigma on that, but we don't put any stigma on that. Okay. We're just like, oh, person got type 2 diabetes and it's being managed, right? So what happens with, let's say, opioid addiction, what happens is every time that a person takes opioids, right, the potential is there for the next time that the cell reproduces, for that cell to reproduce even more of the receptors, for the opioid receptors. And so over time, you get a lot more of those receptors. You build a tolerance to the drug. You become physically dependent on the drug. You need more and more to get the same effect. What's happened by the time that they come to us and they say, I've been doing this for 15 years. I've been injecting fentanyl, 5-6 times a day. What happens is that when they don't have that, their cells are screaming, right, for that drug. And those receptors, what's fascinating about those receptors is that if there's no other opioid present, Those set of 7 different types of receptors are actually busy regulating your hormones and your neurotransmitters. And that's why people feel so terrible when they go without it. When they go into withdrawal and their hormones and their neurotransmitters get out of balance, it's just horrible. And we can see that in all the effects of the, we just tick off the effects one by one on the clinical opioid withdrawal scale, and it's not pretty. So when someone comes to us and they say, well, is this going to fix me? Well, no. What buprenorphine is going to do actually is it's a partial opioid instead of a full opioid with that extra part that inspires the body to produce more and more and more and more and more receptors. It's a partial opioid. So it goes in there and it just manages the withdrawal. It just occupies all those receptors, and the person, fixes it and forgets about it for a 24-hour period. And then, of course, there's most of the drugs we use have naloxone in them. So the naloxone slowly goes in there and fills all the others, which then it acts as a blocker. And then, of course, it helps to prevent overdoses if somebody does relapse. So a really fantastic drug. What's fascinating to me is when someone will go on buprenorphine for a few months and then they just decide that they don't need the program anymore and they just quit, right? And then they inevitably call us up and they're like, you didn't tell me there was going to be withdrawal from this stuff. Okay, let's start at the beginning here, right? You came to us with a raging opioid addiction, right? We told you we were going to manage that. When you stopped taking the drug that we were using to manage it, right, you went right back to the level of physical dependency and withdrawal that you were going to go through before you came to us. It's the same thing with the person who has the damaged pancreas because they develop type 2 diabetes from eating McDonald's every day. If they don't take their metformin and their insulin, they're still going to have a 400 blood sugar pretty much like as a given, because they simply can't process that. The key component is this. It's the behavioral health care. It's the fact that you see a counselor sometimes weekly, bi-weekly, or monthly, so that you always have someone to talk to. You always have someone to help you work through the anxiety, the trauma, the depression. You always have somebody to contact so that you can work with that person to address the mental health issues, which were really driving the need to use something powerful as an opioid to suppress those tendencies in your emotional health. And so that for us is the key. Like I tell people that's like 75% of it. Like the drug is like maybe 25% of it, works really great. It's fantastic. But the rubber meets the road when you start getting into the mental health aspect of it and you really start connecting with your counselor and you really show up and you really show up to do the work. That makes all the difference.
Right. And they can't, if they were not to take that medication and they were just to go into counseling, because of the way that they feel, it would be hard for them to focus on the counseling part of it until they feel better.
And that's the challenge. That's the particular challenge of, and I'm not bashing abstinence only programs. Okay. I've known many people that they've helped. They don't work very well for opioid use disorders. They have about a 6% success rate on that. Okay. Alcohol, gambling, sex, things like that. Those are, abstinence programs work very, very well in getting to the core of those issues and really helping people heal. With opioids, if you go through a 7-day detox program and you do a 21-day stay in an abstinence-only residential program, you are still in subacute withdrawal by the time you get out of there. So what's the first thing you do? You call up your guy and you get a fix. And then you enter into the really, really, really dangerous zone, which is the 3 biggest risk factors for fatal overdose upon relapse.